Hi, I'm Dr. Larry Eichenfield from the University of California, San Diego and Rady Children's Hospital, and I'm here at the Society for Pediatric Dermatology and discussing a very exciting poster presentation, which is the Lebrikizumab data on pediatric patients. So Lebrikizumab, we know, is approved right now in patients 12 years of age and older, and this is the pediatric data from patients 6 months of age through 17 years of age with moderate severe atopic dermatitis. This is looking at the 16-week data. This is very important information for us to have. Study was designed as a typical study, but this was a placebo-controlled trial, 2-to-1 randomization, so twice as many people got the lebrikizumab as got the placebo. Because it's a pediatric study, it was felt appropriate to have topical corticosteroids or similar topicals being used standardly so that no patient had placebo only for 16 weeks. And so there was a run-in of several weeks of topical corticosteroid or TCI. And then patients got their injections, which were either lebrikizumab or the lebrikizumab placebo. The results were very, very impressive in terms of the outcomes. So there was a statistically marked improvement in the patients with lebrikizumab. The almost clear rate was in the high 40% as compared to the placebo group, which was sitting at around 15% over the 16-week time period. The EASI-75 response was also quite good. It was 62.6% of lebrikizumab patients made it to EASI-75 at that 16-week time period versus a little over 20% in the placebo group. Other outcome measures that I think are really important to look at include sort of higher penetrative response in the 16 weeks. So EASI-90, it was over 38% of patients in the Lebri group made it to EASI-90 at 16 weeks, as compared to less than 12% of those in the placebo group. EASI-100, actually almost 14% of individuals made it to 100% EASI in the 16 weeks. And the itch improvement was rather robust as well, with 41.9% of patients having worse itch NRS score a decrease in that 6-month to less than 6-year group, where it's mostly a surrogate. It's the worst scratch itch. And then the 4-point NRS, the numerical rating scale 0 to 10, it was about 34.5% in the Lebri group who had that a 4-point drop as well. Safety data looked quite good as well. There was quality of life impact data also presented. This is really interesting. You know, at the time that we're doing this, only dupilumab is approved under age 12. This is a core data set of a specific IL-13 blocker in younger children through the adolescents with atopic dermatitis, and interesting data for us to deal with.